Tethered oral tissues can have cumulative effects on growth and development. Stay tuned because today you will discover how to recognize clinical signs of tethered oral tissues and optimal timing and preparation for successful frenectomy release outcomes. Hi there, I'm Dr. Krista Burns, founder of the American Posture Institute and your host for Peds Week Online, the Pediatrics Virtual Summit for Healthcare Professionals. It's an honor to introduce our next guest presenter. Dr. Rishita Jaju is a board-certified pediatric dentist and founder of Smile Wonders and Pediatric Laser Academy in Reston, Virginia. She's a Harvard-trained mommy dentist, a TEDx speaker, author, and a published expert in pediatric and laser dentistry. Today, she'll be sharing with us recognition and management of tethered oral tissues in infants and children. Dr. Jaju, thank you so much for joining us as a speaker for Peds Week Online. Please take it away.
Hey there, thank you for having me. I am a pediatric laser dentist, and evaluating mouths and swallows for kids and things like that are a part of my job and my passion. Although I understand for many of you, it may not be a part of your hobbies list. I get to see a lot of parents and their babies every day. Our office is not your average dental office with the spa-like calming music and quietness for calming the patient. It's a kids' fun playhouse. We get to hear kids bop and Disney and seasonal music every day. And many days we see parents that come with their kids of various ages, so happy to share the little ones with the oohs and ahs and how smart and advanced they are, or my kid scored a goal, or my kid did this and that. And we love hearing those stories. But today, I want to tell you about the other set of stories that I hear in my office each day, too. The happiness of having a baby, or happiness of having a child that is thriving, surviving, enjoying life and school is stolen from them. Some of the moms go through a painful, stressful feeding journey. And then once they have been kind of given the brush or the dismissal, or not really felt like they have been listened to, they resort to asking for help from the big wide internet. And then somehow they find me. That's why my presentation today, I want to talk about why can't my baby feed well? Did you know that 1 in 10 babies are born with oral dysfunction related to lip or tongue tie? And let me tell you about a story of a baby, Aiden. His mom was scared for his health, and she found me in her quest for answers. Within 24 hours of giving birth, baby Aiden had lost more than 10% of the birth weight and was taken away for observation. That day, she had spent her whole day trying to feed him. But after that first beautiful latch, as she says, Aiden just would not feed well. She was completely caught off guard. With all her research and preparation, she thought she knew what to expect. Nothing would have prepared her for what was coming her way. The sharp pain, cracked, bruised, blistered nipples. And to make it worse, her baby was fussy the whole time. He was crying at the top of his lungs and falling asleep exhausted after a few minutes of feeding every single attempt. Her goal, like many other moms today, was to breastfeed exclusively while she was on maternity leave. But bearing the pain, round the clock pumping and bottle feeding We're not even getting Aiden back to his birth weight all the way through to 2 weeks of age. At that time, it became a problem. He hadn't met his birth weight by 2 weeks. Finally, a savvy lactation consultant brought up the possibility of a lip tie or a tongue tie. Maybe the mouth wasn't working as expected, she said. Until then, whenever she brought up her struggles, everyone just kind of labeled him as a lazy feeder. He's giving his mom a hard time. He's giving his mom an attitude. And to make it worse, when she would lose it, so to speak, in her words, she said, I would just give up. People would console her, try to give her some encouragement, try to ask her about her milk supply. They would ask her about how she was feeling. And honestly, that just seemed to trigger her. All the encouragement to her made it feel like it was a judgment on her abilities and her mental health versus anything to do with the baby's abilities. You see, we are all born with a connective tissue called a frenulum. And oh my gosh, I meant to show Aiden's pictures while I was talking about it. But anyway, we'll keep going. So you see, we're all born with a string of connective tissue called a frenulum inside our mouth. It connects the upper lip to the upper jaw, or lower lip to the lower jaw, or it can connect our tongue to the floor of the mouth. I should have a picture of it somewhere. Hold on 1 second. We'll come back to this part. Here we go. If you run your tongue all across your mouth inside all the way, and I know when you guys are listening to me, everybody tends to do that, you will feel some little tiny connective tissue, little strings inside the mouth. If you try to reach inside your mouth and try to reach the left, right, last tooth inside your mouth with your tongue, you'll be able to tell that your tongue, the tip of your tongue, should be reaching all the way far back. But when we have a lip tie or a tongue tie, we cannot do that effectively. When you run your tongue across inside your lip, it's not that tiny little string that kind of you feel gently. It's that your lip has a very difficult time just coming away from the teeth, and your tongue has a difficult time coming away from the floor of the mouth. When that frenulum is too short or too tight or too thick, that's when it becomes a tie. And depending on different ages, where the effects become really, really prominent and symptomatic, and I say it like this because it's not about appearance, it's about function. So whenever we are at the milestone in our life where our function is being affected, that's when it is recognized as a tie. So we all have frenulums in our mouth. There are many different frena, but when they are restricting function, they become a lip tie or a tongue tie or a cheek tie. As I was listening to this story, 3 big red flags jumped out at me. The fussy baby, the mom that is in pain while feeding her baby. And this was not just while at the hospital was the most shocking part. It continued all the way up to 2 weeks, remember? So when mom is feeling pain while feeding beyond the first week after birth, baby is fussy while or after feeds. You know, baby should be calm and in that little nice food coma afterwards, after they finish feeding. but they're fussy. They're trying to manage air. They're trying to get themselves fed without using up a lot of calories. And a baby that is making noises while feeding, the clicking, the smacking sounds, or having to use their lip, their jaw, their cheeks. On the other hand, an easy feed should be the lip, upper lip flared out, and the tongue doing the nice wave motion. So these three red flags that jumped out about Aiden's story, if you guys are hearing, I know we'll come back to this again as well, but I want you guys to pay attention to that. As I was looking at the baby and I started talking to her, I'm also starting to perform my evaluation inside the mouth. And I am looking and feeling actually, all the signs that explain his symptoms. When I put my finger in his mouth, he could not make a seal around my finger. His lips would not come inside and make a nice seal, okay? His tongue was not able to lift away from the floor of the mouth to have a nice rhythmic swallow. He was using up more calories in the process of feeding than he was gaining from feeding. So that kind of explained his slow weight gain. His shallow latch was noisy, and that noisiness I could feel with the loss of seal happening from the tongue every time he was actually trying to swallow. So right there, under my fingers, I could feel how a tiny little small tight string was having an overall impact on Aiden's feeding experience. So this is just one in a thousand stories that I hear every day. Over the past 10, actually 15 years of practicing as a pediatric laser dentist, I have heard these stories hundreds and thousands of times, but every single story still makes an impact. A few simple clicks of Google search will give you a perspective on the gravity of the situation. And if you let me go back to where I kind of lost my space while I was talking. If you look at it, the Mayo Clinic, we talked about how the estimate is 1 in 10 babies, right? The American Academy of Pediatrics actually recommends that babies be exclusively breastfed for 6 months, followed by breastfeeding along with other forms of feeding up to 2 years of life. But then we also know that the CDC reports that 60% of mothers do not breastfeed as long as they intended to. And the top 2 reasons are because they're having issues with lactation and latching, or they're concerned about baby's intake. So we have the guidelines that say this is the best thing to do for our babies, but I feel like we don't have the support system required to help moms find out if these guidelines are not easily followed. In this day and age, I find that many of us moms do a lot of Google, ChatGPT, AI research to try to do what is best for my baby. But then after that basic guidance, things seem to fall apart when it comes to addressing things for our individual children or individual babies. So coming back to the example of baby Aiden, once I had seen inside his mouth and found out that there in fact is something that is in the way of his feeding, I knew that the next step would be to talk about how to manage the problem. And we would have to talk about doing a procedure. And how moms and other providers get as soon as we start talking about a surgery or a procedure for their baby. So I had to explain the pros and cons of doing the procedure. I had to talk to parents about what it is that we are seeing and how it is explained by the anatomical findings that I'm seeing inside his mouth. Once we had both the parents on board, I was able to perform the procedure with a simple laser frenectomy. And I want to say simple because I think in the world of surgeries, it's not a major surgery. Does not require hospitalization, does not require local anesthetic. It can be done with a gentle water-based laser. In our office, we use a water laser. In other offices, there could be many different types of lasers. And it's a few minutes that a child is away from the parents, and then they can feed immediately after. However, not to make light of a surgical procedure, we want to make sure that we are looking at the full picture and have consulted with other specialists, especially someone like a lactation consultant or a feeding therapist may be involved in helping rule out other reasons that might be contributing towards the feeding difficulty. It could be more than one. It could be that lip or tongue tie is just one little part of the puzzle. But looking at the big picture and including the lip or tongue tie is going to be my goal that you go home with as you spend this 15, 20, 30 minutes with us. We have found that over the years, because of the complexity of our medical model, our doctors are inundated with things that are required to be addressed from a biological, medical reasons or legal, logistical reasons. And they are also having to now keep up with technology and keep up with one of my friends, keep up with the things that are required as a part of their 15, 20 minutes that they spend with the family in their regular checkup visit. One of my pediatrician friends said they had close to 43 different systems that they have to make sure the baby is doing well in for within their 10, 15 minutes that are allotted for that visit. So I want to tell you that while our pediatricians and our other physicians are meaning well and they're trying to rule out any life-threatening conditions, they may not be equipped or have the ability to dive into all the feeding and efficiency related things that moms and primary caregivers might be struggling with. So it is really important that if your baby and you are having a hard time with feeding, bring up some of these concerns before the pediatrician asks you about them. Guide them to help you well. Bring up the concerns about the efficiency, frequency, comfort, effectiveness, because if a pediatrician is asking or interested in, is this baby gaining weight or not? And you are spending 20 hours out of the 24 hours feeding your baby, they are not going to know that until you make them aware of it. So I want us all to be the advocates for the moms and babies. You know why I'm so passionate about it? Because I was one of those moms that struggled with feeding my own baby. When my baby was born, it was a long journey. We had the IVF process, we had the fibroid removal, we had all the things that kind of got in the way of this nice miracle. And by the time I had my baby, I felt like that was the end of my struggles. And once I had my baby and he was having a hard time, it really, really took away all my confidence. When my baby was having a hard time, did not meet his birth weight by 2 weeks, I asked my husband, do you think there is a problem? And he is not even in medicine. And it was the most interesting time of my life. And you know what was even funnier? We went to our 2 week checkup. My pediatrician knew that I was a pediatric laser dentist. He asked me, how do you think the baby is doing? I wasn't going to tell him that I was crying every feed and that I was having a hard time because is my baby doing well is my question. But honestly, when the baby had not met his birth weight, I lost it. And any type of confidence or information that should have had in my head about my baby, it felt like I was so busy failing at being a mom that I forgot that I should be looking inside his mouth. His lactation consultant recognized my name, which I did not want her to recognize, honestly. She said, "Are you Dr. Jaju? We sent some of these babies to you. Do you think he has a tie?" And that was the aha moment for me. Two things happened at that time. It reminded me that there might be a real problem that my baby is having, and it's not just in my head. And two, there is an answer to it. And it gave me a way to think about a problem and a solution rather than getting engrossed in the emotions of it. So, moms, I want to tell you today to trust your intuition, to trust that if you are having a lot of trouble with feeding your baby and you see those 3 red flags we talked about, let's go back to those. Hold on. There we go. You're having pain while feeding. If your baby is bottle fed, are they having long feeds? Are they struggling? If you are not breastfeeding, but you are seeing that the baby is having a hard time with bottle, it still applies. A baby that is fussy while or after feeds, whether it is breast or bottle. And if the baby is making noises, the clicking, the smacking, the loss of seal type noises. So you see those 3 red flags, you are struggling. Seek out a specialist. It doesn't always have to be a surgery, but at least get a professional support. And families, you can help document the signs of improper mouth function. You can tell a mom that let's just see for how many times we have trouble. Because moms sometimes, when we talk about mom guilt, it's real. Moms sometimes feel maybe I could be doing it better. Yes, if you could be doing it better, get help. How can we do it better? If it was something where a baby could be doing better, then let's find the right support so that the baby can grow up in corrected anatomy rather than keep limping along with using what they got. Because, tongue ties and lip ties or frenectomies are not just for newborns. As they grow up with these ties, they keep having to manage around or work around these ties at every single milestone. When they transition to table foods, they have a hard time with textured foods. They have to learn how to roll foods from one side to the other. And if their mouth cannot cooperate, they either become smacking, messy eaters, or they may become pickier with what types of foods they like. And it's mainly because they couldn't manage the other types of foods. Textured foods become a problem. Say we, as parents, help them compensate around the textured foods during that time frame. Well, the next time they're going to have trouble is when their teeth are coming in or their jaw is developing. You're going to have gap between the teeth. They're going to have a hard time reaching everywhere for the natural cleansing ability of the tongue. So then guess what? They have higher cavities rate. They have a gap between the teeth, and it becomes a little bit more of the quality of life concerns, right? And the next phase, say that was not necessarily picked up at that time. The next time they would be having to work around is with speech clarity, not speech delay. So speech delay may not be related to tongue tie because cognitive abilities, personality, and things like that may take care of a baby that is tied but is really interested in wanting to talk. But the speech clarity, the r's, the st's, the complex sounds, the fluency, all of those can get affected if we have a baby that is having to work around their ties. And then finally, there might also be that impact on that restful sleep. If the tongue is out of the airway, up next to the roof of the mouth versus down low and in your throat, the type and quality of sleep is also impacted by the tongue ties or lip ties. So I want to encourage my families to be advocates and supports. But then my hope is that many of us who are part of the families are also in the professional, medical, or allied healthcare arena. And we, as healthcare providers who may or may not be part of a family that is struggling from it, is doing right by our patients and our friends and family. Make sure that we have ruled out some of these things that can be helped by professional support before we go into the encouragement mode. Yes, we moms need a lot of encouragement, the sleepless nights, the the fussy baby and things like that. But let's not just encourage without figuring out whether there is a problem that we can resolve. Okay. So I want to be able to say that after all of us who are talking about this, we go out and we talk more about it to our own people and the circle of influence. Maybe we will have more families that can go to their pediatric dentist and continue talking about how well their child is doing rather than figuring out, am I doing this right? Am I feeding my baby right? So I hope this helped you guys kind of shed a light on a common yet often misunderstood concern of newborn feeding difficulties. Thank you.
Wonderful. Dr. Jaju, thank you so much for your excellent presentation today. And thank you for those inspiring words. And yes, we absolutely need to work together as healthcare professionals on behalf of our patients by finding solutions and most importantly, having an integrative team working together to find the person who can support those babies, especially with those feeding issues. Now I'm going to go through a summary and then a couple of questions for you.
Sure.
So you talked about how moms can go through a painful, stressful feeding journey. They don't feel listened to, they're experiencing sharp pain, bruised nipples, fussy babies. They may start to think that there's a problem with them. They feel frustrated. So, why can't my baby feed well? 1 in 10 babies are born with tongue tie or feeding issues. Babies losing birth weight, and mom's frustrated and feels judged, like she's not doing something correctly. And unfortunately, the babies can just be labeled as lazy feeders. So we looked at the frenulum, the connective tissue inside the mouth, connecting the upper lip to the upper jaw or the tongue to the floor of the mouth, and the lip to the lower jaw. Restricted frenum is known as an upper lip tie. Restricted lingual frenum is the tongue tie. So ties do not allow the lip and the tongue to move freely and are commonly seen inside a baby's mouth that's struggling with feeding difficulties. So recognized as a tie when they have that functional restrictions.
Mhm.
3 red flags to watch for: mom in pain while feeding beyond the first week, baby is fussy while and after feeds, makes noise while feeding also, they're using their lips, their jaw, and their cheeks to compensate. Feeding is noisy with clicking or gulping sounds, and could not make a seal around. You gave a great example of with intraoral palpation. The baby could not make a seal around the finger with intraoral palpation, and so the tongue was not lifting away and using more calories during feeding than actually gaining calories. Exclusive breastfeeding for approximately 6 months is recommended, followed by breastfeeding with complementary foods for at least 2 years. The CDC shows that that 60% of mothers do not breastfeed as long as they intend to. So only 40% are actually meeting their
Their
guidelines.
goals.
Yeah, issues with latching and lactation, and then concerns about infant nutrition and weight are the issues. So you shared with us laser frenectomy, a simple surgery, no local anesthetic or hospital stay is required, takes a few minutes, and baby can feed immediately after. Pediatricians may not have time to assess feeding related issues. As you mentioned, they're looking for everything in 15 minutes. So have moms bring up concerns regarding efficiency and comfort concerns and be advocates for moms and their babies. You share with us an amazing personal story. Thank you for sharing that so openly, and recognizing that there is always an answer to the problem. Find the right support for mom and the baby to thrive. Also, long-term effects could be higher cavities, gaps in the teeth, speech clarity, and fluency issues can be impacted, and then also impact on restful sleep. So ultimately, we as healthcare providers, we need to do right by our patients, rule out things that could be helped by professional support, and then encourage and empower mom and baby to continue to thrive. Really excellent. Thank you so much. A
Of
couple of
course.
questions for you.
Mhm.
Regarding babies who have tongue tie, if do you see any changes of their posturing that of their head or their jaw position in relation to this?
Very good question. And that's something that I didn't bring up because it does not always show up, but shows up often enough, is babies that have lip or tongue ties oftentimes also get diagnosed either early or a little bit later on with torticollis,
Mhm.
neck tightness, difficulty during tummy time because they're having airway concerns and they're posturing or arching to kind of manage that discomfort and air management concerns. The other thing that I often find, so early on, if I get referrals, they're from lactation because the feeding concerns are happening. But if mom's supply is doing well, and sometimes some moms have oversupply, and it's a feeding is a two-part project, right? So if all of that is going well, around say 4 to 6 months of age, many times I get babies that are referred to me from physical therapists or chiropractors or my CST provides, the craniosacral therapy providers, who notice that there is asymmetry because the baby is compensating, turning their head certain way to get that muscle out of the way. So plagiocephaly is often seen, and then we go backwards and try to see what else could be the root cause
Mhm.
of that problem.
Excellent. Thank you for sharing that. And then after doing the procedure, I recognize that it takes just a few minutes. Baby can start feeding right away after, which is amazing. Is there anything that you recommend that the mom does in any sort of stimulation or exercises for the baby to get the tongue working again, or anything that they need to do post care?
Absolutely. So I didn't go too much into the details of preparation towards and post-op care. I felt like I had to cover a lot in 20 minutes.
Yeah, of course.
However, there are things that the lactation consultant does beforehand to get access, mom's comfort level inside the mouth, figuring out what are the parts that are difficult for baby to do.
Mhm.
And then after procedure, on that day we say just cuddle, rest, relax, feed on that day, but the next day onwards we do ask moms and parents to do post-op wound management exercises and suckery training. That way the motion that the tongue muscle had to do with that tie should be almost unlearned, and the rehab work to get that correct muscle movement started. So we have to do some exercises afterwards for sure. And that does become something that we do a lot of parent education and preparation. But if a baby had figured out a way to compensate and work beforehand, that baby is going to figure out a way afterwards. It's just that we have to kind of support and help guide the progress. So
Yeah.
yes, there are exercises.
I love that. Thank you so much for sharing with us today. And as we wrap up another great session today for Peds Week Online, I'd like to acknowledge Dr. Jaju for her excellent work in pediatric dentistry. I'd also like to acknowledge you, the healthcare provider who's learning up-to-date clinical solutions to serve your pediatric patients at the highest level. I'm Dr. Krista, your host for Peds Week Online. Be sure to get the Pediatric Clinical Pearl Super Pack for ongoing summit access and tools for simple implementation into your practice. Stay tuned, and we'll see you on the next Pediatric Masterclass for Peds Week Online.